So for core work, in supine and prone, so on your back and on your stomach, you can move the child laterally in the water. You can do sitting on a balance or a kickboard, and we have this little like inclined V board that we use that you can sit on, or you can use a kickboard. You can do deep water walking, so they have little like flotation belts that you can use. You can use a noodle wrapped around the child's waist. You can use your hands, and you can just do walking kind of in the water supported. You can do knee to chest using flotation support, and I have a picture of a flotation support later on, but you can use your hands, depending on the size of the child. You can use your hands, you can use a noodle, you can use, they have the little aquatic belts, you can use any of those to help the child stay afloat. So knee to chest repetitions using flotation. You can sit straddling on your noodle, and so we kind of brought some noodles in to show.
So you can use a couple noodles, and again, there's other ways you can hold them if your child needs more support. You can brace them by squeezing the noodles to help support their trunk a little more.
And they make thicker noodles too, that kind of bring you up to the surface a little bit more, but you can kind of squeeze the child between the noodles, or if they're able to hold on to the noodle themselves and hold up, you can do that.
Wrap them like this, which is another way if you don't have access to specific flotation devices. You can use noodles in lots of different ways to hold them up, or behind their head. Put one behind their head and one underneath their pelvis to support them this way. I put it all untangled here. Put one under the neck or head, base of the skull, and then one under the pelvis can help to support. So noodles are a cheap, easy thing to get.
Yeah.
But you can use a lot of different ways if you don't have access to a lot of other equipment.
Yeah, and they can provide just as much support as a belt would. So, and then you can do reaching along the surface to kind of push a ball or pop a bubble, just to get some arm exercises in. And they also make barbells. You can probably find them on Amazon or on online. They make little barbells that are kind of like weights for the water, and you can push them under the water, or you can push them just on the surface of the water. And they make different widths of them, so the thicker they are, the harder they are to move under the water, the thinner. Yeah, they're made out of styrofoam foam, and they just have like a little handle, and so you can use those kind of like weights in the water, but they're not as heavy as the weights, but when you get them under the water, it's like pushing a weight. Exactly. So here's kind of what we just talked about. To isolate the leg movements and to just gain overall strength in the water, you can straddle a noodle, and we just call it riding the bicycle. And they can hold the noodle if they want, or you can hold them and support them if they don't have the hand dexterity or strength to hold onto the noodle, and just work on kicking with those reciprocal movements. A lot of kids want to do the kind of bunny hopping, moving their legs, so I would encourage to try to get those reciprocal leg movements in like you are if you're walking. Floating on their back with support, swaying side to side, getting the lateral movements of the trunk. What we said, you can support them depending on the size of the child, or you can use noodles underneath them to support the child, or you can put the belt around them and they can float up. And then the other thing I'm going to show you too is a head flotation device, and basically you put that on and you can let the child go and they're just floating. I mean, you can focus working on their legs, and they're really cool.
And this
so we'll
one
have a picture of
is
it.
nice to help kind of break up that tone in the trunk. Sometimes kids are really stiff in their trunk and have a hard time with rotation and even relaxing to get passive stretching. So this is a nice one to get a passive stretch. Kids tend to really relax when they feel that warm water. We use really warm water in our facility. So if you sway their upper trunk back and forth holding their shoulders, their pelvis can dissociate, and they can really get some nice relaxation and stretching between the upper and lower doing this exercise. So more treatments. You can do hip extension or flexion with their head supported. So bringing the hip up or bringing it down. You can do it in upright. You can do it with them upright, or you can do it with them on their back. It really doesn't matter. So you can do hip extension like this. You can do hip flexion forward. You can do it on their back, pushing into the water, getting a little bit more resistance there. You can do clamshells, so to get hip abduction and adduction. So if they're on their back, sometimes I use a ball and have them try to hit the ball out to the side and move like that, and do it on both sides. You can put their ankle or wrist over a noodle, so sometimes I'll lay them on their back and put their ankle over the noodle and trying to get them to do hip and knee flexion by pulling their leg off the noodle.
And then you can also hit a ball with a noodle. You can have them, if you have 2 noodles, you can have them straddling the noodle and holding a noodle and trying to hit it, or you can just have, you can support them and have them try to hit a ball with a noodle along the surface. Kickboards are also great. You can do on their stomach, you can do prone, you can do kicking in that position. They can hold on, or you can help them hold on to the kickboard. And then you can also use a kickboard for them to sit on and work on core control. So this is the sitting on the kickboard with the parent supporting. You can move the board like a boat. You can rock it from side to side and try to get those righting reactions in. So if you tilt them to the left, you're trying to get them to lift up to the right. If you tilt them to the right, you're trying to get them to lift up to the left. If you tilt them forward, you're trying to get them to lift up. And if you tilt them back, you're trying to get them to use their tummy and lift forward.
And then the swing one with the noodles is like this, where they're basically sitting on, you're pinching and they're sitting on it under the water, so their neck might be up to the water, but they're sitting on this underneath the water like a swing to give similar kind of balance support and working on their trunk support on that position with the water supporting them.
And I've also worked on some core stuff straddling the noodle. So you can straddle the noodle and kind of tip it forward and see if they'll right themselves back up. You can tip it backward and see if they'll right themselves up forward and to the side. And I kind of say like riding the horse, and I sing the little horsey song. Yeah.
It's also effective if you're using some kind of neck floater.
Yeah.
We are getting to that. That was a good time.
Mm-hmm.
We have pictures of that coming up here too.
So this is another option which we already talked about for support. You can use the noodle to wrap the child around the child like a boat, and so just kind of to support them.
In that position, you can have one parent holding them if you have both parents or 2 adults holding them in that upright, while the other parent's helping the kid or dissociate the legs underneath the water too.
And you can use the noodle forward like that, or you can put it around the other way and use it toward the back. Sometimes I'll use it to the back if I want them to try to use their arms to swim, so then that front part of the noodle doesn't get in the way. So this is the head support I was talking about. They make a bunch of different ones. There's a lot of different options out there. There's the little just kind of ring support that you can get from the store. This one we actually found online, but it's really great, and even if it gets a hole in it, it still will float.
It looks really uncomfortable, but my kids use it. It looks like, oh my gosh, you're strangling a kid. But when you put them in it, they actually really like it. The kids are very comfortable and supported, and my little girl that uses one very similar to ring type that she's talking about, but it fits the same way. And she really loves being in the pool and floating, because then she can feel herself floating without anyone holding her, and she loves it.
And I have a kid actually using this, and at first I thought that their head was supposed to go in the other way and the stuff was supposed to be in the front, but it's really, she says it's really comfortable when she wears it, and I can just kind of let her float. She doesn't get her ears wet, she doesn't get her face wet at all, and I can focus on her legs, and we can focus on reaching. I do a lot. It kind of depends if the kid's going to sink or float. Her legs usually kind of float up, but I think depending on the mass of the child, they might, and the tone, they might sink more.
And when you think about, we talked about 35% of your body weight is here. When you're up to here, it's 10%. So really that neck ring is supporting 10%. So it's maybe 2% of the body, or 10% of the body weight is maybe like 2 pounds or 25 pounds or something that's supporting. So that's why it's not a big pull on their neck ring.
And so this child looks like their feet are underneath them, but my kids, her feet actually go up, and so she's actually like laying on her back, and so we work on a lot of like anti-gravity reaching, so to pop bubbles, trying to get just little arm movements to pop bubbles. I even do like the little barbells back and forth while she's on this. You can do that as well. You can put the noodle, you can straddle the noodle as well while she's doing this. I put her feet on the noodle and she tries to pull off. You can do that while they're, this is just kind of so you can focus on other things while they're still above water and supported. And so we got a couple different articles about literature, what it says about aquatic therapy, and these are kind of just the key points that we got. So it improves overall passive range of motion, specifically hip abduction and knee extension. It improves active range of motion, specifically shoulder flexion and shoulder abduction. It has the effects of reduced spasticity of the knee flexors and hip abductors compared to only land-based therapy group. The 6-minute walk test distance, which measures endurance, improved significantly. They found increased body awareness with the kids that did aquatic therapy. They saw improved respiratory function, improved gait efficiency, and you can also interpret this as improved cardiovascular function because they saw that their walking heart rate decreased, and then increased perceived social acceptance. And then I only have a little bit about the land therapy because the main focus of this talk was aquatic therapy. But for land physical therapy, it will mainly focus on maximizing the child's current function and assisting with functional mobility and the strengthening that is appropriate for the child. And so in order to get that, you have to see a PT or a physician. It will focus on proper posture, so doing the exercises while you have them in the proper alignment. And the PT can show the parents that, so then they can incorporate that at home as well. And then we'll also help aiding in the equipment selection and evaluation along with an assistive technology provider. And so episodes of care is what I was talking about. So if you've gone to therapy for a long period of time and you're kind of at a maintenance phase, we might meet, once every quarter or once every 6 months to do equipment kind of checks like that. And so children with CP who are non-ambulatory, so GMFCS level of 4 and 5, have a 70 to 90% risk of developing hip dislocation. And these same children are also at highest risk for joint contracture and scoliosis. So here's where standards come in. So they found that children that stood for 60 to 90 minutes per day showed significant improvement in hamstring range of motion and hip migration percentage. And then there's also strong reasons to believe that this 60 to 90 minutes doesn't have to be done all at one time, that you can kind of break it up in 15-minute bouts if your child won't tolerate the 60 minutes all at one time. So having daily access to standards for these kids is very important to decrease scoliosis, the hip dislocation, and just get weight bearing.
We have we'll talk about equipment too.
Okay, so I'm sure they'll talk about that. So this is just really little. And I think on the sheet that they put in your folder, they have on the back, they put a bunch of outstanding frames as well. So that's good. And so some key things to remember is try to work with your child in the correct alignment, so you're working the correct muscles and they're correctly aligned. And then keep activities fun, so try to make games out of it, hitting the ball with the noodle like a bat, baseball, stuff like that. Make it fun so they don't just think it's exercise.
They like bubbles, bring bubbles in the pool as well, and have a reach for those along the surface of the water where it's easier than lifting their hand above the ground on the land.
And you can get like a toy on the side, so if you have like a step, you can practice, some standing weight bearing. You can have them like pour water in a toy or something like that. Just try to keep it fun. And then there is such a thing as too much, so often just a few times a week is just as beneficial as 5 or more times a week. So just making sure that you get in a couple.
Again, over the course of a lifetime.
Exactly,
So,
not just.
The might be good for short bouts of therapy, but then to keep it fun and so that they want to participate in fitness, you want to, it's a marathon, not a sprint, so we want to make sure and make it fun over their lifetime and not burn them out, within a few years and choose not to do anything, any one thing.
And then also in your little resource packet that you got in your folders, there are some community indoor pool options. A lot of them are more up north because we work in Frisco, so we found some ones that are up north, yeah. But they're just different fitness centers and athletic centers and rec centers that you could go take your kid and do some of these exercises at, and they keep their pool at a pretty good temperature for a therapeutic range. So we kind of put those in there, and then we put some miracle leagues just to keep your kid active. There's one in Frisco, and then there's one for the DFW area. So that's great. They offer like bowling, basketball for all abilities, and so that's a really great resource as well. Any questions?
I have a child who's about to have an orthopedic procedure, and I wondered, do you advocate aquatic therapy to rehabilitate once all decisions are healed and so forth?
For after, yes, definitely. For our program, we definitely like to see kids post-op.
So
And so-
what is usually, how many weeks post-op would you?
Whatever your physician says that they can get in the water, and then they'll usually.
Well, they're
have-
saying 6 weeks she can weight bear. She has to wait 6 weeks before she weight bears. So is it sort of immediately once the incisions heal?
Yeah,
would be a good
if
place to
the
start?
physician gives the okay, we can do non-weight bearing stuff in the pool. Mm-hmm.
Yeah, it's really important to find out from your doctor, the
Yes.
surgeon, whether it's okay.
Yeah, you have to
You don't want
get,
to mess up anything they've done, right?
yeah, get the okay from that, and then usually ask for like a list of like precautions or, contraindications that you can't do, and so then you can provide that to your PT. Yes.
What's the pool temperature that you guys normally like to have the pools at for therapy?
Lower 90s.
Yeah, lower 90s, upper 80s, usually. I think ours is like 80, 89.
It runs like 92.
It
I
does,
think,
okay.
but it was at like 95, 96, and we were.
It gets hot, yeah, you can't be in there if it's too warm
It's
for
like
that
kind of tight
long.
range in there, like 88 to 92 or
Mhm.
so, and then
Yeah,
after that
88.
it's too much.
How old are the kids when you start?
They can be any age, so even, young children, you can do the flotation even if you're not working on the weight bearing stuff kind of yet. Really, you can start at any age.